What inspires you to work in the NHS?
The NHS stands as one of the largest healthcare systems not only in the UK but also across Europe. It's a vast network of dedicated healthcare professionals, including nurses, midwives, and doctors, committed to delivering top-notch care to patients. This scale and dedication truly inspire me to be a part of the NHS team. Moreover, the NHS is not just a healthcare system, it's a symbol of national pride and collective effort in providing healthcare services to millions of people. Being part of such a significant organization is not only inspiring but also humbling. I am particularly drawn to the NHS because of its emphasis on teamwork and collaboration. The multidisciplinary approach within the NHS fosters an environment where healthcare professionals work together seamlessly to address complex healthcare needs. This collaborative spirit resonates with my own values, and I am excited about the opportunity to contribute to and learn from such a dynamic team. Furthermore, the diversity within the NHS is remarkable. It serves people from all walks of life, with varying healthcare needs and cultural backgrounds. This diversity presents a vibrant array of experiences and challenges, which I believe will enhance my skills as a nurse, and broaden my understanding of patient care. Joining the NHS, I aspire not only to provide high-quality care to patients, but also to advocate for health equity and accessibility. I am committed to upholding the core principles of the NHS, including its commitment to providing healthcare services free at the point of delivery, regardless of a person's ability to pay. In essence, working in the NHS is not just about a job, it's about making a difference in people's lives, contributing to something much larger than oneself, and being part of a legacy of compassion and excellence in healthcare.
Tell us about the core values of the NHS.
The NHS holds a set of core values that guide its mission and operations. These values are essential for delivering high-quality healthcare to patients, and fostering a positive work environment for healthcare professionals. Let me explain each of these values and how I connect with them. Commitment to quality of care. I strongly believe in the importance of providing safe, effective, and compassionate care to every patient. In my previous roles, I have always prioritized patient safety and continuously sought opportunities for improvement, to enhance the quality of care delivery. Working together for the benefit of patients, collaboration is key in healthcare, and I am committed to working closely with my colleagues, patients, and other healthcare professionals to ensure the best possible outcomes for patients. I understand that teamwork and communication are essential for providing holistic care that meets patients' needs. Compassion. Compassion lies at the heart of nursing, and I strive to approach every patient encounter with empathy, kindness, and understanding. I believe in treating each patient as an individual and doing everything in my power to alleviate their suffering and improve their well-being. Respect and dignity. Every person deserves to be treated with respect and dignity, regardless of their background or circumstances. I uphold the values of honesty, integrity, and respect in all my interactions with patients, their families, and colleagues. Everyone matters. I am committed to ensuring equitable access to healthcare for all patients, regardless of their socioeconomic status or background. I believe in advocating for those who are most vulnerable, and ensuring that resources are allocated fairly, to meet the needs of all patients. Improving lives. Ultimately, the goal of healthcare is to improve the lives of patients and promote their health and well-being. I am passionate about making a positive difference in the lives of others, and dedicated to continuously seeking opportunities for personal and professional growth to better serve my patients. In summary, These core values of the NHS resonate deeply with me, and I am committed to upholding them in my practice as a nurse.
What characteristics do you possess that make you a good fit for the NHS?
I believe several characteristics make me a strong fit for the NHS, aligning closely with its core values. Firstly, I am highly committed to delivering quality care to patients. My attention to detail and dedication to upholding safety standards ensure that patients receive the best possible care, even during busy schedules. Secondly, my ability to work effectively within a team is one of my key strengths. I thrive in collaborative environments, valuing the input of colleagues and working together towards common goals. I understand that teamwork is essential for achieving optimal patient outcomes, and am always willing to go above and beyond to support my team members. Additionally, my flexibility allows me to adapt to changing circumstances, and extend beyond regular shifts when needed. I understand the importance of being available to meet the needs of patients, and am willing to adjust my schedule accordingly, to ensure their well-being. Moreover, my compassion for others drives me to provide exceptional care to every patient I encounter. I approach each interaction with empathy, kindness, and respect, striving to alleviate suffering and promote healing. In summary, my qualities as a hardworking, team-oriented, flexible, and compassionate individual make me well-suited for the NHS. I am eager to contribute to the organization's mission of providing outstanding patient care and making a positive impact on the lives of others.
What do you know about how the NHS works?
The NHS, or National Health Service, is the publicly funded healthcare system in the United Kingdom, providing healthcare services to residents free at the point of use. It is comprised of 4 separate systems in England, Scotland, Wales, and Northern Ireland, each with its own structure and management. In England, the NHS is structured into primary and secondary care. Primary care involves services provided by general practitioners, GPs, nurses, pharmacists, and other healthcare professionals in community settings, such as GP surgeries and clinics. Secondary care refers to specialized services provided by hospitals and other healthcare facilities, including specialist consultations, surgeries, and treatments. Clinical commissioning groups, CCGs, are responsible for planning and commissioning healthcare services at the local level in England. They work closely with NHS trusts and foundation trusts, which are organizations that provide hospital and community services. NHS trusts are responsible for managing hospitals and other healthcare facilities, while foundation trusts have greater operational and financial freedom. The NHS Long-Term Plan, published in 2019, outlines the priorities and ambitions for the NHS over the next 10 years. It focuses on improving healthcare outcomes, integrating services, and addressing key challenges such as workforce shortages and funding pressures. Understanding the specific structure and functions of the NHS in my area is essential for providing effective patient care. I have conducted thorough research and familiarized myself with the local healthcare system, including the roles of various stakeholders, and how they contribute to the overall delivery of healthcare services. Additionally, I have sought advice from contacts who work for the NHS, to gain insights into the inner workings of specific departments, and their roles within the broader healthcare service. This knowledge will enable me to effectively navigate and contribute to the NHS's mission of providing high-quality healthcare to all residents.
Describe a time when you successfully resolved a conflict at work.
In my previous role as a nurse in a busy hospital ward, there was a conflict between 2 members of the nursing staff regarding the allocation of tasks during a particularly hectic shift. The task at hand was to address the conflict, and ensure that the team could work together effectively, to provide safe and efficient patient care. I took a proactive approach to resolving the conflict by first listening to each staff member's perspective on the situation. I provided a safe space for them to express their concerns and frustrations openly. Then, I facilitated a constructive discussion, where both parties could share their viewpoints without interruption. I encouraged them to focus on finding common ground, and identifying solutions rather than dwelling on the disagreement. During the discussion, I helped them recognize the importance of teamwork and collaboration, in achieving our shared goal of providing excellent patient care. We brainstormed potential solutions together and agreed on a revised task allocation plan that took into account each staff member's strengths and workload. As a result of our discussion and collaboration, the conflict was successfully resolved, and the nursing team was able to work together harmoniously for the remainder of the shift. The atmosphere in the ward improved, and morale among the staff increased. Patients also benefited from the improved teamwork, receiving prompt and attentive care from a cohesive nursing team. Reflecting on this experience, I believe that effective communication, active listening, and a collaborative approach were key to resolving the conflict, and achieving a positive outcome for all involved. It reinforced the importance of teamwork and conflict resolution skills in healthcare settings, and I am confident in my ability to handle similar situations in the future.
What would you do if you had to deal with an aggressive patient?
During a busy shift in the emergency department, I encountered an aggressive patient, who was becoming increasingly agitated and verbally abusive towards the nursing staff. The task at hand was to de-escalate the situation, and ensure the safety of both the patient and the staff, while providing necessary medical care. I approached the situation calmly and confidently, maintaining a safe distance from the patient, to avoid escalating the aggression further. I used non-confrontational body language and a calm tone of voice, to communicate with the patient, acknowledging their feelings and validating their concerns, without condoning their aggressive behavior. I ensured that the patient felt heard and respected, empathizing with their frustration and assuring them that we were there to help. I remained patient and composed, refraining from reacting emotionally to the patient's outbursts. Meanwhile, I discreetly signaled for additional support from security and other healthcare professionals, to ensure the safety of everyone involved. I employed de-escalation techniques such as active listening, redirection, and offering choices to help diffuse the situation. I maintained a professional demeanor throughout the encounter, prioritizing the safety and well-being of both the patient and the staff. As a result of my actions, the aggressive patient gradually began to calm down, and their behavior became less hostile. With the support of security and other staff members, we were able to safely provide the necessary medical care to the patient, while ensuring the safety of everyone involved. The outcome of this situation was positive, as we were able to de-escalate the aggression effectively, and maintain a safe environment in the emergency department. Reflecting on this experience, I recognize the importance of remaining calm, patient, and empathetic when dealing with aggressive patients, and I am confident in my ability to handle similar situations in the future.